Hi, my name is Dr. Fred DiDomenico of Elite Coaching, and we're a higher level for spinal corrective practices. What I do is I help doctors communicate on a level that helps inspire a greater percentage of patients to want to transform their life with your spinal corrective practices. Now, have you ever been in a report of findings where you know you can help someone? You know clinically you can make those changes, yet no matter what you say, they're just not getting it. And after all that, and they have all these sicknesses and chronic pain and problems, and you know you can help them, and what do they say? What's my insurance to cover? Doc, can you just crack my back? How frustrating is that? Because you could help all these people, even if you have 8 out of 10 commit to care, 7 out of 10, you feel like you're doing great. Who's the one person that you're thinking about? That one person that no matter what you said, you just couldn't help them see what you see. That's so frustrating. You know, I went through that same thing in practice. Even though I had successful practices, you know, the more convicted you are to the purpose, the more every person counts, the more every person matters. And what's the difference? Sometimes it's the sickest people that need your help the most, that have the most potential, that are hardest ones. Why is that? Because we didn't know how to talk to them. So what I realized after multiple management groups is I couldn't find it in chiropractic. You know what I learned from management groups? Is how to talk about a subluxation to a patient. When in reality, everybody's different. People buy with emotion. They feel things. That's why they buy. So I spent 10 years outside of chiropractic with advanced communication coaches, becoming a life coach, spent over $100,000 in years to learn why people make decisions they do, how to help people come in with one perspective and see something totally different, like a hologram. How can they look at those x-rays and then see what you see? Well, I went through so much advanced training, but being a spinal corrective doctor and knowing that's a life purpose, then I applied that to spinal correction, to a report of findings, to a consultation, to learn how people communicate. And what were the results? I developed a boot camp system where you can come in 2.5 days, you can learn what took me 10 years and tens of thousands of dollars in 2 days. You can learn how to totally shift the way you talk to people. Would you talk to a CEO the same way that you would talk to a stay-at-home mom with 4 kids? Would you talk to them the same way you talk to someone who's hopeless with fibromyalgia? You would use totally different vocabulary. Or are you describing an x-ray? Which one are you doing? Well, after taking hundreds of doctors in the last 5 years through these boot camps, I've had the opportunity to watch people completely transform, to help them look at their patient differently, to help them think differently, talk differently, view their practice and purpose on a whole nother level. And they come back, and people they could never get to commit, old patients that would never commit, that come back in with pain, commit to programs. New patients that they typically didn't even know how to handle, write them a check. People that they've had challenges for years, all of a sudden they're ready to commit. You watch people's face light up as they begin to get it. Those results have been life-changing, not only for the doctors and patients, but mainly for me. It's been a huge blessing to watch people fulfill their purpose on another level. Hey, we're in a new world now, man. The old world, Mercedes 80s, all you had to do was people had insurance. You know, you didn't have to be able to communicate that well. This is a new world. Insurance coverage is getting worse. We have different economies where people have been more reluctant to pull out money. Do you know how to communicate on a level, no matter what the economy, that people are going to find money? We have lots of doctors that do that. Why? Because they've been getting trained. This is a new world. You got to communicate on another level. And there's a myth out there, people don't want wellness. You know what the truth is? The American public pays more money out of pocket every year for wellness. They want what you have, you just have to know how to communicate on a higher level. So here's what we do. I show you 5 steps, 5 emotional steps that every person has to go through applied to spinal correction. When you take a person through these 5 steps, the probability they're going to want to be inspired to transform their life, do something they've never done before, rises to a whole nother level. You can learn these 5 steps and how to communicate on a level that if you don't have training, you don't know how to go through this. This isn't something you can just know. This is something that takes training. Those 5 steps are the difference between where you are and fulfilling your vision. That bridge is these 5 steps. So what are the most common mistakes? Talking about a subluxation rather than talking to a person and bringing them through an emotional process. So what's your first step? Call today. There's a boot camp April 19th through the 21st in Boise, Idaho at the CBP clinic, the new treatment and teaching clinic in Boise, Idaho at Dr. Deed Harrison's clinic of CBP. It's a phenomenal experience. First step is call today. Call me personally at 253-851-8353 and I'll give you the details. You know, sometimes our life is defined not by what we do, but by what we don't do. Don't not do this. You deserve to fulfill your vision, and you deserve to have the best opportunity that every person standing in front of you can learn that they deserve to live an unsubluxated life. Hopefully I'll see you in April.